King Henry VIII is one of the most notorious monarchs in history. He began his reign as a golden boy, athletic, educated, and adored. But by the end, Henry VIII was paranoid, violent, and obsessed with control. Could his violence and insecurity have been the result of an illness? In his youth, Henry was everything a Renaissance monarch was meant to be: a composer, athlete, and reformer. But later in life, he condemned 2 wives to death, ordered the death of close friends and advisors, threatened and disowned his children, and ruled through fear. In 1536, Henry was thrown from his horse and lay unconscious for hours. From that point, his personality seemed to fracture. He became increasingly unpredictable, impulsive, and cruel. There are many theories about King Henry's health. One of them is that he suffered a traumatic brain injury, possibly similar to what we'd call CTE today. It's seen in athletes after repeated head impacts, and can trigger rage, paranoia, and loss of impulse control, all traits Henry developed after not only his accident, but also years of participating in violent jousts. Historians have also considered the possibility Henry suffered from a chronic illness. Later in life, he battled chronic leg ulcers, morbid obesity, pain, and extreme fatigue. It has been hypothesized that Henry could have had diabetes or Cushing's syndrome. Both can cause irritability, depression, and memory loss. Blood abnormalities are another possibility historians have considered. Some historians think Henry carried the Kell-positive blood factor and suffered from McLeod syndrome, a genetic disorder that only affects Kell-positive individuals. McLeod syndrome weakens muscles, causes dementia-like cognitive impairment, and typically sets in between the ages of 30 and 40. This theory also suggests Henry's Kell-positive blood type could explain his wife's miscarriages due to blood incompatibility. To the court, Henry's erratic behavior looked like madness. He executed close advisors without warning, accused wives of betrayal, and shifted from affectionate to murderous in days. His sexual compulsions and obsession with male heirs drove both policy and bloodshed. Modern medicine can't diagnose a 500-year-old king, but between possible brain injury, chronic illness, and genetic complications, Henry VIII's decline looks less like unexplainable tyranny and more like a tragic unraveling of his body and mind. To learn more, check out these resources online or at your local library. Please follow us at History Bites Unlocked, unlocking history one bite at a time.